Good evening to you, Mr. Hemant Rohera and Sunil Masti. Welcome to the DCN studio. We're very glad to host you today. And I'm sure the topic that we're discussing today is something of great interest to people in Pune and nationally and even internationally. So let's make this a very, very interesting podcast. To begin with, I would like to know what exactly is e-media and what is it that you've actually made?
E-Medica is a medical device. It helps correct the electrical parameters of the human body. Now, we've been seeing so far that only the chemical parameters, like you have illness, you take a medicine, you have diabetes, you take a medicine, you have anything, you just take a medicine. We don't look at the electrical parameters of the body. So we are proposing that correcting the electrical parameters would enhance the medicine effect and reduce the dosage of the medicine.
When did you make this?
We're working on it from past 9 years. Okay. We had a prototypes ready 9 years back, and we commercially launched it in 2020. Now it's been 5 years. It's all in the market.
And how many hospitals have validated this? And
around 50 hospitals have validated it. We had clinical trials over 20,000 patients. We have medical publications, over 17 medical publications, and 4 more publications are pending. Soon they should be online as well. This data for various diseases like diabetes, hypertension, Parkinson's, paralysis, brain strokes like autism patients. So we have database of various diseases where this has been validated on good number of patients.
But hospitals only in Pune nationally?
No. So we validated this in major hospitals who are in Maharashtra, since we are based in Maharashtra. Some hospitals outside Maharashtra as well.
Okay. And how does this work?
So I'd like to show you the product.
Yeah, please do.
Keep the adapter on.
Is it very heavy or it's quite?
No, it's light.
It's quite
light.
Okay, it's quite light.
This works on the battery backup. It has a 30 hours power backup. Now, I would like to give you some examples, what exactly we do and how exactly it works.
And how many patients have used this?
More than 20,000.
20,000
In Maharashtra?
across India.
Across
India
and in Malaysia and UAE, we have database of various countries. So we program this. There are 14 programs in each device. Now, for example, I'm personally diabetic. I'm on this device. I'm programming it for diabetes. Now, I'll tell you what exactly I did. This device, now I just programmed it. It's passing electrons in my body. Why electrons? Our entire body is electrified as part of our MBBS studies.
Right.
Our healthy cells are negatively charged. They vary between minus 70 to minus 90 millivolts. Now, what I'm passing in the body is minus 70 millivolts. It is correcting my electrical parameters, enhancing the effect of my human body. One, it is passing a specific frequency which is targeting my pancreatic cell termed as beta and other cells in the pancreas, which improves my organ function. So is it just for diabetes? Answer is no. It is for all your 78 organs in the human body. You have different frequencies, different voltages, which targets and improves the organ function overall.
So if there's somebody has a problem, so there are different programs already.
Different programs already.
Just have
to program.
Okay.
So if I had to say what are the effects of using it, say I'm diabetic, I use this device. I say if my sugar levels, if I had to really validate it in front of you. So if my sugar levels were 250 right now, I use this device, it will come down by at least 50 to 100 points without intake of any tablet or any medicine.
But this has to be used every day?
Every day, at least for a diabetic patient every day. Any lifestyle disease like diabetes, it could be hypertension, it could be cholesterol, lifestyle diseases, you need to use this every day. This is a device to be used by every family, every house.
Along with the medicines?
Along with the medicines, but what it is doing is reducing the medicine dosage. Say for example, I was consuming a 500 mg tablet to control my diabetes. Because it is allowing the medicine effect more effectively. What exactly is doing? It is infusing voltage, current and frequencies. What does the voltage do? It passes electrons. What does the current do? It burns the fat in and around the cell. The food what you consume contains some amount of fat and does not allow the uptake of insulin. Why does the sugar level come down after using this device? Or why does it improve your parameters? It is improving the uptake of medicine. Because it is improving the uptake of medicine. So I was having a 1000 mg tablet. Actually, I needed just 200 mg.
So your dosage reduces.
I'm reducing the dosage. I'm saving your kidneys. lower amount of chemical, you see, like I come from Pune. Initially, 20 years back, I see only 2 or 4 dialysis centers in Pune. Now, trust me, the numbers would be 500.
Oh, yes.
So why has the population gone up by 500 times? Answer is no. We compromise over the food. Number one, we have heavy dosages of chemical. Number two, can we reduce the dosages of chemical? Yes, by using this device. I'm not eliminating it. I'm reducing the dosage, making the medicine more effective. Balancing your chemical and electrical parameters would be more efficient to have a human body get cured than just chemical or just electrical.
And
So
just to add on to what Hemant was talking about, once you take chemical dosages, what it also not only does impact your bodily function, but it also has multiple side effects that are not probably untoward. And that is perhaps one of the reasons that we are actually eliminating the amount of intake of chemicals. And that is perhaps the reason
your
why
side effects are also much
lower, because it's non-invasive, right? There is a lower chance of you actually incurring any side effects that actually will have a long-standing issues with respect to your disease.
But can this be used by cancer patients and people who are like terminally ill and?
Definitely, there are more than 100 cancer patients already using this device on daily basis. I would not, on the camera, I would not take the names. They are patients where they were said you might lose your life in 6 months, or it's just 3 months time.
Yes.
They have completely revived back.
Oh, that's good.
I'm not saying that they did not go in for chemo or radiation shot. They did, but after chemo or radiation, I have reports your platelet counts and your RBC counts, everything goes down. Here it improved. Platelet improved, your other parameters improved. I did not put them away from medicines. I just aligned this along with medication. We have last stage cancer patients back to normal life. They've been using this device for 8 years, 9 years, 6 years.
But what's the duration? How long does one need to use it?
So a cancer patient has to stick to the device for the rest of their life. Somebody who's diabetic, if he's controlling over the lifestyle, say I don't control over my own lifestyle. So I'm pitching this. So if I control over my lifestyle, if I have correct my parameters, my HbA1c's come back to normal, but if I want to get away from diabetes completely, not just this device, then I need to control over my mouth as well, control over my sleeping habits, my eating habits, etc., my weight, other parameters.
And what's the cost of this machine? Is it?
So we're selling this device for 2.5 lakhs in the market. A part of that, we're giving this in subscription. Somebody subscribes it, pays us 30,000 upfront money, which is non-refundable, and 6,000 per month.
I mean, what we're also trying to understand from the market is, because it is still a predominantly doctor-led initiative, right? So it takes a lot more on an education and advocacy basis, where we are unable to straight away reach to the masses. So our strategy has always been to bring the doctors onto our platform. So what we have undertaken is we have associated and aligned with most of the hospitals in the country, such as Apollo, AIMS, and a bunch of Nanavati, etc.
So,
quite a few of them, which enable us to first of all validate the market with respect to their own doctors. That actually gives us a little bit more strength to go into the market. They themselves become, the doctors within that hospital themselves become advocates for them to sell subsequently. Similarly, we have aligned with ourselves with all the clinics across the country, who again become our advocates to essentially treat the prevent cure side of the area, because where those people have already tried all the medications, all the avenues were tried, however they were not able to still get the results that they needed. So those are the people that we are actually trying to address at this moment. So coming back to your question, we charge around 2.5 lakh rupees per device. That is the market price. Along with it, what we also do is we do a subscription-based model. Most of our clinicians and the hospitals are going through the subscription-based route, where we sell it to our hospitals and healthcare devices, healthcare clinics, who in turn look at a hourly or a monthly pricing for the
subscription for the end user.
But if somebody wants this machine today, so how would they reach you?
Through our website, through their various, around 800 doctors are already promoting it. Okay. Through our website, they can directly approach us. But we mostly align all this through doctors. We have doctors on panel. We have 13 doctors working for us full time.
Okay.
So we definitely route this through doctors. We don't directly jump our guns looking at the reports. We make sure that the doctor is monitoring the patient day in and day out. The results are in place. The patient is getting satisfactory. We are not just promoting a product to sell the product. We actually selling services. We want to be a service-based company, not give you results and charge you for it. You might pay me double, but if you're not gaining results, what's the point having you on board?
Does this have all the certifications, the FDA and the...
We have FDA in place, we have CDSO in place, we have ISO in place, we have C certifications. Main in our country, we need FDA and CDSO to come in place. While you gain FDA and CDSO, that's only after clinical trials and medical publications, which we already have in place.
We have published around 17 peer journals as we speak, India and globally, and we are patented in 150 countries.
What is the name of your device?
eMedica.
eMedica.
Yeah.
All right. Anything else you'd like to share with our viewers about the machine? It's all very interesting, and I'm sure it's going to help a lot of patients.
Yeah.
And the fact that even from a common cold, as you told me, up to cancer, that means it's got a wide range of ailments that it can help a patient with.
Yes.
So
most of the devices in this country at this moment are essentially diagnostic, at least on the wearable side. There are very few transformative products that you see within the healthcare business, and most of the healthcare side of things is essentially driven chemically, which we want to change it at the we are actually looking at a transformational product in terms of what we are trying to do. That is one. Secondly, we want to make it available to the entire masses, thereby reducing the cost burden for health in the country. Obviously, it takes a lot of challenge for us to make this change to happen. It requires a lot more effort from us to actually reach out to the market. We require advocacy like platforms such as yours to help us to probably promote and make it much more accessible to the masses as well. So there is a lot more work to be done. Having said that, we are actually looking at how we can actually miniaturize this product even more, have a much more easier and a nimbler function in terms of how we can actually reach out to the masses.
And this you have a bag to... it comes along with the bag.
Comes along
with
a bunch of
materials. It's not complicated to use at all.
It's absolutely not complicated. Anybody who has used a mobile phone or a laptop, it should be straightforward.
So I'd like to enlighten one point. Why should one go in for this? Like, why should a doctor prescribe eMedica, or why should a consumer use eMedica? Say, have you ever heard a patient complaining that I took this medicine but it was not effective?
Yeah, you hear this all the time.
You hear this all the time. The doctor is always right. He gives you the right medicine looking at your parameters. Like, I have my blood reports. I look at the blood reports. My HbA1c is 10, 11, 9, whatever. Okay, based on your blood reports, he gives you the right medicine. But what happens? The medicine does not reach the cell. What am I doing right now? I'm infusing electrons, rebuilding your immunity. One, I'm infusing microcurrent. A microcurrent is improving the uptake of medicine, making medicine effective. So when you're making medicine effective, your parameters are bound to change. You see that change in 30 days. Majority change comes in for major diseases. You see a change. You see a diabetic HbA1c coming down in 30 days. You see your parameters changing in 30 days. So ultimately, you're making medicines more effective. Because you're making medicines more effective, you're reducing the dosage of the medicines and not allowing the side effects, as he rightly said, not harming your kidney or other parameters of the body. So making medicines more effective, that is what we're targeting. Improving your electrical parameters, that's what we're targeting. A doctor should prescribe that, because this device only for one simple thing, allowing the patient to correct their parameters soon and earlier and reduce the dosage. Not completely replace it, but reduce the dosage.
And can this be used by children and adults and the old people all alike, or?
Somebody with a pacemaker cannot use this. Okay. Pacemaker works on similar science. It enhances the muscle cell charge. Somebody with a pacemaker cannot use it. Somebody with an autoimmune disorder needs to inform us that I have autoimmune, so I need to change the programming and the frequencies, reduce the immunity instead of increasing the immunity. So we just be careful. The reason we have doctors on board monitoring
To
the patient's
guide
health,
them
to guide them
correctly.
the right way.
Correctly.
Somebody with a pacemaker, it will interrupt the frequencies and the voltages of a pacemaker because it's working on the similar sites.
Another layman question
Sure.
is, does one use this immediately after taking the medicine or at any time of the day?
So we advise this device to be used after lunch, after dinner.
Okay.
Okay, after you had your meals. So generally, somebody takes a medicine. Say if somebody was diabetic, he would take a medicine early morning. That's the normal, and then go in for the breakfast. So after your breakfast, after heavy meal, whatever you had, you use this. After 15 minutes of gap of your any meal, you use this device. But a cancer patient, he has to use it 3 to 4 times a day because he's on the critical stage. So there's no underline that you use it after lunch or after
So
dinner.
a cancer patient typically would use it for how long?
I would say
Say
he
3,
would
4 times a day. So how many?
minimum 3 times a day, 30 minutes
30
each.
minutes.
Yeah, each session.
All right.
There are 3 programs to it. One is 30 minutes, then there's the 60 minutes and the 90
90
minutes. Our doctors prescribe it according to the
According to the health parameters.
According to the concern of the patient.
Yeah.
All right. This, I think, is a fantastic product. And I wish you all the very best.
Thank you.
I'm sure it's going to do extremely well.
Yeah.
And I hope it's available easily everywhere. And I hope the doctors really create awareness for your product.
Yeah.
Wish you all the best.
Thank you.
And thank you once again for coming to our DCN studio. Thank
Absolutely.
you so much.
Thank you so much for having us.
Pleasure is all ours. Thank you so much.
Thank you.